The Healthcare Labyrinth Podcast is back for another episode. Join Marc S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth Podcast, where we navigate the complex world of healthcare each week. My name is Marc Ryan, and thanks to everyone for listening in. The podcast title today, With the Feds Failing, States Take the Lead to Fight to Control Healthcare Costs. We're diving into one of the biggest, most frustrating issues in America, healthcare costs. Why is it so expensive? Why hasn't Washington fixed it? And why are states now stepping in to do something about it? Because here's the reality. Healthcare costs in the U.S. have risen dramatically. Hospital prices alone have increased over 250% since 2000, growing twice as fast as overall healthcare spending and nearly 3 times the rate of inflation. So if the federal government isn't acting, who is? Today, we're breaking down how states across the political spectrum, from Vermont to Indiana, are stepping in to regulate hospital prices and what that could mean for the future of healthcare. In addition, many states have said we need to basically find a way to cap overall spending growth in healthcare from year to year. So many states are moving on that initiative as well. Let's get into it. We will take our regular 3 breaks today to break it up a bit. So segment 1, why Washington is stuck. I've made the case before that healthcare reform is largely frozen at the national level, and it's not hard to see why. Neither party has truly tackled the root cause of costs. Republicans tend to focus on reducing benefits. Democrats push for expanding subsidies to deal with healthcare cost increases, but neither approach fundamentally fixes the pricing problem. And that's key because the issue isn't just access, it's price. Even modest reforms have struggled to stick. To his credit, President Trump has tried to begin to tackle price. Under Trump 45, there were incremental efforts, but they were rolled back by President Biden. Trump 47 has now sought to put those changes back in place under a new rule. They include the start of site-neutral payment reforms. We'll talk more about that later. Retiring the inpatient-only list, expanding what procedures can be done at ambulatory surgery centers, and addressing reform of the 340B drug discount program. Otherwise, Congress seems reluctant to address the core issue, how much healthcare actually costs, except perhaps for the recent passage of pharmacy benefit manager reforms. Meanwhile, employer-sponsored insurance premiums are surging. Individual coverage now costs all in over $9,000 per year, with family coverage now at $27,000 per year. So if Washington won't act, states again are stepping in. With that, we will take our first break, and when we return, we will begin to go through what some states are doing about price generally, and specifically on hospital prices. Be right back.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Marc Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Marc dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage and a private delivery model. Marc is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Marc's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back, and thanks for listening to the Healthcare Labyrinth Podcast. My name is Marc Ryan, and we are talking about states stepping in where the feds will not on prices in healthcare and specifically on hospitals. Let's get to segment 2, States Step into the Void. Since federal action is limited, states are trying to tackle healthcare costs themselves. But there's a catch. Federal law, especially ERISA, prevents states from regulating self-funded employer plans and Medicare pricing directly. So states can't fix everything, but they can influence large parts of the system anyway, especially hospital pricing. And they're doing it in three ways. First, hospital price caps. Second, cost growth limits. And third, transparency laws. So let's start our state review with Vermont. Progressive Vermont has taken one of the boldest steps in hospital pricing. A 2025 law sets hospital price caps tied to Medicare rates across all payers. They're also moving toward global hospital budgets by 2030, meaning hospitals get a fixed annual revenue. That's a big shift. It essentially treats hospitals like regulated entities. Next is Indiana with its conservative price pressure. Indiana, a conservative state, passed a law targeting high-priced nonprofit hospitals. Hospitals must reduce prices to below the statewide average by 2029 or risk losing tax-exempt status. That's a key thing for hospitals. This isn't a hard cap like Vermont, but it certainly will get hospitals' attention. Both Indiana and Vermont are using powerful leverage to offset ongoing price hikes. Because in nearly 50% of U.S. metro areas, just 1 to 2 health systems control the market. And research consistently shows two things. First, consolidation means higher prices. And second, at least sometimes, perhaps most of the time, it could mean little quality improvement or even worse outcomes. So states are responding to a lack of competition by regulating prices directly. With that, we will take our second break, and when we return, we will continue on with more states and what they are doing about prices generally and specifically on hospital prices. Be right back.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back, and thanks for listening to the Healthcare Labyrinth Podcast. My name is Marc Ryan, and we are talking about states stepping in where the feds will not, on prices in healthcare and specifically on hospitals. We are on to segment 3 here, different hospital price models with the same goal. Next on our list is Maryland, the pioneer. Maryland has long been ahead of the curve. It uses an all-payer global budget system for hospital prices. Hospitals get a fixed revenue cap each year. That limits cost growth. It controls pricing indirectly. It's one of the most mature systems in the country, and it's already delivered slower cost growth compared to national averages. Let's next talk Washington State. Washington is capping reimbursement to hospitals for its state employee plan at 200% of Medicare for in-network and at 185% for out-of-network. This all starts in 2027. This directly ties commercial pricing to Medicare, a major shift. As I said earlier, commercial prices piggyback on Medicare. Could this lead to extending the law to other employers in the state over time? We shall see. Now Maine. Maine is focusing on cost growth limits tied to federal hospital payment benchmarks, and it applies to smaller plans and state employees. A New York proposal is exploring site-neutral pricing. If passed, the law would cap certain outpatient services at 150% of Medicare rates. If implemented, it could save $1 billion annually in the Empire State. Now that we have covered hospitals, let's move to cost growth benchmark states. Several states are creating affordability boards. California, with targeted growth at no more than 3% annually, Massachusetts, Oregon, Connecticut, Nevada. These states track spending, set targets, and can impose penalties. And finally, we have transparency efforts in states. This is the most common approach. States like Ohio, Oklahoma, Virginia require hospitals to publish negotiated rates and consumer pricing tools. Because let's be honest, healthcare pricing is still incredibly opaque. With that, we will take our last break, and when we return, we will discuss what the Fed should do in the spirit of collaboration with the states. Be right back.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Marc Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Marc's insights. Twice a week, Marc publishes a blog to go deep into a current issue. And of course, Marc hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Marc's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for healthcare news.
Welcome back, and thanks for listening to the Healthcare Labyrinth Podcast. My name is Marc Ryan, and we are talking about states stepping in where the feds will not on prices in healthcare and specifically on hospitals. On to segment 4, what this means for the future. So what does all this mean? First, this is a bipartisan issue. Both red and blue states are acting. That alone tells you something. The problem is real, and it's getting worse. But state action has limits. It creates a patchwork system, not a national solution. Still, these efforts point toward what could happen federally. So here are some key federal opportunities. Here's where real impact could happen. Site-neutral payments, number 1. Equalizing hospital outpatient payments throughout all places of service in Medicare could save $157 billion over 10 years. And even more money in the commercial market because of the piggybacking of rates. As a former hospital board member, I am sensitive to fallout on hospitals, healthcare, and employment. Let's face it, hospitals often are the biggest employers in some cities and towns. But that doesn't mean that we shouldn't have efficient hospitals and an efficient healthcare system. A planned phase-in approach to site neutrality would protect hospitals and what they bring to communities and bring about efficiency over time as well. Number 2, price alignment. We should standardize pricing across either the nation or in regions and do it across insurance types, Medicaid, Medicare, and commercial. This would stop placing much higher costs on employers and also promote efficiency over time. And yes, it could take some additional funding from Medicare and Medicaid. Number 3, drug pricing reform. I give Donald Trump a lot of credit for the work he has done on drug price reform, but it needs to be broader and swifter. We especially need it for commercial plans, which is still largely untouched. Number 4, primary care investment. We need better focus on primary care and prevention, which would lead to lower long-term costs. We need investment here nationally. Number 5, PBM reform, a major driver of drug pricing of inefficiencies. We had a good start this year with reforms, but far more needs to be done. Number 6, we need to address market consolidation. Hospital mergers continue to drive costs upward. Planned mergers do as well. Both payers and hospitals have unseemly market control in many areas. Hospitals also gobble up physicians, which is leading to changing practice patterns and services at higher cost settings, thereby driving up costs even more. So the core problem, here's the uncomfortable truth. It's not just insurance companies driving costs, as many people believe. It's high prices across the system, especially hospitals. Healthcare isn't a normal market. It behaves more like a utility. And increasingly, policymakers on both sides are starting to accept that. States are experimenting. Some will succeed, some will fail. But they're doing what Washington hasn't and should do, actually trying to control prices. In my book, I discuss that price reform is the key to the future of healthcare, along with primary care and prevention and affordable universal access. But getting to the root problem of high cost is an important step to success. Until we address pricing directly, affordability will remain out of reach for millions of Americans, and we won't have the money to invest in primary care. Thanks for listening to the Healthcare Labyrinth Podcast. If you enjoyed today's episode, be sure to subscribe and share it with colleagues interested in healthcare policy. Until next time, stay curious, stay skeptical, and keep navigating the healthcare labyrinth with me. We will find our way out together. Again, I'm Marc Ryan. This is the Healthcare Labyrinth Podcast. See you next week. Take care.
Thanks for joining Marc and the Healthcare Labyrinth Podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth Podcast.